Weight loss is probably one of the most important advice we give to our patient. As mentioned earlier, if someone lost 5 kg, they can reduce their surgical risk by 30%. And here, I think the reason being that for every 1 kilogram weight loss, the joints, the burden on the joints is reduced by about 5 kg. And that's especially true if you are climbing upstairs, because when you climb upstairs, your knee is bearing a lot of the burden. It's 3 times the body weight. Yeah. Then, of course, where there's no choice, we sometimes have to go for surgery. Usually, surgery is indicated if the pain is so bad that it doesn't get better with any of the non-pharmacological or the medication that we give, or the patient is so disabled that they cannot live the life that they wishes to live. So we then advise surgery. In fact, surgery is a very well-known, cost-effective approach to treating this condition. So most commonly is a joint replacement. We put artificial joint or prosthesis into the knee or whatever joint is affected. Usually the knee and hip is easy to replace. The fingers are not easy at all with artificial joint replacement. The back and the neck is also not so straightforward. And sometimes the doctor may just do realignment osteotomy. In other words, they cut a bit of the bone in such a way that the joints are realigned appropriately. And this is actually better than just putting a metal, because that can something that's naturally yours is always better than putting in something foreign, right? Then arthroscopic surgery is if they do some scopes to see where they can remove certain loose bodies and wash out the joints a bit, because sometimes these loose bodies can cause jamming of the joint, right? And then, of course, increasingly there are some research on resurfacing using stem cells, although this is still under experimental stage. And then, of course, where everything fails, the doctor can fuse the joint, unless the joint doesn't move. So a joint that doesn't move will therefore has less pain, but it's really a treatment of last resort. And of course, as mentioned earlier, the surgery is actually a very cost-effective method, and it can be total knee replacement, or it can be one compartment where there's just a partial knee replacement. Whatever it is actually effective as well. The doctor who is doing the operation can advise the patient on what is the most suitable surgery to do based on the condition of the patient.